The MetroCrest Medical Foundation, a nonprofit organization established in 1979 to be the fundraising arm of the MetroCrest Hospital Authority, supports the healthcare needs in the MetroCrest communities of Addison, Carrollton, Coppell, Farmers Branch, the Colony, and pockets of Louisville and North Dallas. This story best describes how the MetroCrest Medical Foundation helps people of all ages and all economic backgrounds to obtain a better quality of life. It is about helping you see how your dollars given to the foundation can and will make a difference in the lives of people around you and quite possibly your own. First, though, let's see how involved in our communities the foundation is. We are fortunate that the Hospital Authority entrusts us with their community service funds to be granted out to agencies in our service area. Each quarter, the Foundation's grant committee, made up of dedicated board members, assures that the requesting agencies meet MetroCrest Medical Foundation's granting criteria, then makes their recommendations to the full board for approval. Area health-related agencies who have benefited from grants received from MetroCrest Medical Foundation include women and children of family abuse or violence, physically challenged individuals, and individuals suffering from AIDS. Children whose families cannot afford to visit a dentist also benefit. Often these children are alarmingly close to losing teeth and are absent from school. The dentist's salaries have been partially paid by MetroCrest Medical Foundation. Medical clinics where checkups and vaccinations are offered are also included. Any student or adult on a Carrollton Farmers Branch or Coppell School District campus is safer because of funds donated by MetroCrest Medical Foundation to install automatic external defibrillators at each school. Children in other programs receive first aid kits, and biomed students have also benefited. MetroCrest Medical Foundation has assisted in funding flight services for cancer patients being taken to chemotherapy treatments all over the South Central region by volunteer pilots working through our Addison community. Our grants have helped those in our community with needed prescriptions, eye exams, and glasses, and have provided vital exercise classes for seniors, improving their quality of life. Local community seniors have been transported to their doctors and needed medical treatments through use of our grants. MetroCrest Medical Foundation funds support our hospital volunteers by funding specialized training in spiritual care, as well as support programs for children who have lost a loved one or parents who have lost a child. All of these agencies and more have received funds from MetroCrest Medical Foundation to continue their healthcare programs in our communities. While monies from the MetroCrest Hospital Authority fund all the grants we have mentioned, one other organization, Brookhaven College, has received grants from these same funds, but the foundation has also created an endowment to continue support in the future, making it fit into both categories. So let's get to the part of the story where you can be involved, the things for which the foundation raises funds. In 2003, Brookhaven College realized the tremendous need for radiologic technologists in our hospitals and asked MetroCrest Medical Foundation to partner with them. Through July of 2006, 16 scholarships had been given to deserving students, and the H. Stewart Peak Endowment was formed to continue this program. Funds raised continue scholarships. Each of us has probably known someone with breast cancer. In 2003, MetroCrest Medical Foundation established the Women's Health Fund to offer $11 screening mammograms to women ages 40 to 65 who have no insurance and are asymptomatic. The foundation also has partnerships with agencies to do follow-up treatments as needed. Funds raised for this program continue to support women's health. People coming out of the ER departments of our community hospitals who upon discharge have no ability to pay for life-sustaining medications. Through the MetroCrest Medical Foundation's Ken Wells and Pastoral Prescription Assistance Program, these necessary prescriptions are paid for on a one-time basis until the patient can attain public assistance. The foundation partners with local pharmacies for low-cost prescriptions. Funds raised for this program allow us to keep these people out of our ER departments and home where they can get better. Today's teens are faced with peer pressure every day to fit in, and unfortunately, some go as far as to join gangs. What happens when they realize they made a mistake but have been tagged by the gang? and have potentially ruined their lives. They want out. They want a job. They want to join the armed forces. They want a better life for themselves, but doors are closed to them because of their gang tattoos. The Foundation's D-Tag tattoo removal program allows teens to have homemade gang tattoos removed. They are required to do 10 hours of community service for each laser session. MetroCrest Medical Foundation has set up a partnership with local dermatologists, dedicated Carrollton Farmers Branch Independent School District nurses, our community hospital, Southwest Ancillary Services, and Carrollton Police Department, all who volunteer time, expertise, and machinery to run this program. Funds raised provide for the laser technician and the necessary topical ointments and bandages. You can only imagine the chill bump moments the volunteers share with a teenager who says she has just received a promotion in her job, or he is starting at a local college, or they tell a police officer that the program has changed their lives. The kids are proud, and the Foundation is proud to be a part of their future. Many in our community are taking care of their aging parents, some still living in their own homes and some living with their children. They want to live independently, but the fear of falling or needing assistance is great. MetroCrest Medical Foundation's Al and Vera Jordan Lifeline program pays for the monthly fees of the Lifeline emergency call system for residents living in our community who qualify and are screened through a partnering agency. It offers peace of mind for the resident as well as their family. Funds raised for this program can mean the difference between life lived to its fullest and being confined or dependent on others for care. The Foundation has also been entrusted to manage the following endowments. Funds still need to be raised for each of these to allow for continued support in their designated areas. These Foundation programs are ongoing and vital to residents in our community. These are the programs for which the Foundation currently raises money. MetroCrest Medical Foundation is very proud of the fact that we hold ourselves to the highest standards for being good stewards of the funds entrusted to us by donors like you. The board and staff of the MetroCrest Medical Foundation are passionate about actively building relationships and continuing to seek support so these programs can be continued and new ones started. What started out in 1979 to be a way of the hospital authority giving back to the community has turned into a dedicated staff and board helping thousands of people live a more healthy and productive life. We hope this story has given you just a glimpse of the smiling faces of grateful recipients, dedicated healthcare professionals, and volunteers involved with the Foundation. Please remember these faces and stories when considering your giving opportunities. By working together, we will achieve the Foundation's mission, which benefits people of all means. And by working together, we can make a difference in the lives of people and our communities around us. Please visit the Foundation's website for more information on anything in this video, as well as continually updated activities and needs for the future.